Hi everyone, it's Dr. Lindner. Let's take a look at some of the main blood vessels of the heart. So the heart is a muscle and muscles need blood flow. They need oxygen, so the oxygen can go to the mitochondria, so the mitochondria can produce ATP so that the muscle has energy to contract. So blood flows through the coronary arteries and delivers oxygen into the myocardium. And the coronary arteries, there's a right and left coronary artery, they arise from the ascending aorta. Okay, so this is the arch of the aorta right here. And before it, since blood is going up, that's ascending. And when blood goes down, that's descending, descending aorta. So here's the ascending aorta. Now, right off the ascending aorta, here's the pulmonary trunk, just for reference. On one side of the pulmonary trunk, we'll see one coronary artery, and on the other side, we'll see the other. So here, I'll put a star there. There's the right coronary artery. And on the other side of the pulmonary trunk, we'll put a star here. There's the left coronary artery. Okay, there are some other blood vessels that come off the right coronary. There is there's a marginal branch, which is important. The marginal branch comes down like this, goes down to the apex of the heart. Off of the left coronary, there's an important blood vessel called the circumflex branch, and the left marginal branch. We have some veins that we can see as well. There's an anterior cardiac vein right here. There is a great cardiac vein that's important. Now, off of the left coronary, coming down, there's a very important blood vessel right between the right ventricle and left ventricle, and that's called the anterior interventricular branch. And it kind of follows the interventricular septum. But in that interventricular septum, there's a groove on the outside of the heart. That groove is called the interventricular sulcus. A sulcus is like, if we're looking at the surface of the heart, it's this depression. That's the sulcus. So in this valley, that's where this blood vessel travels. The anterior interventricular, it's sometimes called the left descending artery. They're both interchangeable. Okay, so let's take a look where we can see on this side, we see the arterial side, and on this side, we see the venous side. So here's the ascending aorta. Here's the right coronary artery. And then right here, we can see the left coronary artery. Now remember, the pulmonary trunk would come up like this, right? And that's why on this view here, we see the pulmonary trunk, we see the left coronary artery coming on this side of the pulmonary trunk, and we see the right coming on this side. But here, we dissect out the pulmonary trunk. So this is the pulmonary trunk. So we can see the left coronary and the right. If we follow that right coronary artery down, here is that right marginal branch. Here's the left coronary. We follow it down, it wraps around to the posterior, that's the circumflex branch. And then we have the large one that goes down the front that's called the anterior interventricular branch, sometimes called the left descending. Okay, those are the biggies on the front there. Here is number 1, number 2, number 3. Those are the 3 main branches of the trumpet, right? I call them the 3 valves of the trumpet, the 3 branches off the arch of the aorta. That's the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. Let's look at the veins. All right, here's the superior vena cava coming into the right atrium. And here's the inferior vena cava bringing deoxygenated blood into the right atrium. Now on the posterior side, right there, right, there's the 3D view looking holographically at the back of the heart. That's the coronary sinus. Remember, that's posterior. That's why it looks lighter, because it's on the back, right around to the back. It's going to dump blood into the right atrium. Okay, here's the great cardiac vein following the, it would follow this right here, the anterior interventricular branch. Okay, the great cardiac vein comes around, and it's still the great as it wraps around to the back. On the back side, we have a middle cardiac vein. And in the front, we have an anterior cardiac vein and a small cardiac vein. Okay, here's the pulmonary trunk, and here's the pulmonary arteries. Notice they're all blue. Why? Because it's got deoxygenated blood. Okay, when we come back, we'll talk a little bit about the EKG.